There's no two ways about it. Vet bills and vet care can be very expensive. But if you're struggling to afford your pet's vet bills, then I've got some strategies that might just help you today. Welcome to the Dr. Alex Answers Show. If we've not met before, I'm Dr. Alex, the veterinarian behind ourpetshealth.com, where my aim is to help you and your pet to live a healthier, happier life. And in this show, I answer all of your dog and cat health-related questions. Now, I had a reply from one of my newsletters from one of my subscribers, and they said that their biggest challenge was how to afford vet bills and how to afford vet care for their dog. So this is a really common concern. There's no getting away from it. Vet care can be expensive. And if your dog is very unwell, if they have a serious accident, then sometimes there are very few options other than the more expensive ones. But we can think of breaking down healthcare into preventative treatment for our pets, so trying to keep them healthy, and reactive treatment, or treating them when they become unwell or when they have an injury. So there are a number of different ways we can go about affording both options. So if we're looking at preventative healthcare, then there are a number of different products that we can use to help, for example, remove parasites in our dogs. So it might be that the tablet that lasts for 3 months, that does all your fleas, does your ticks, does your worms, is the most convenient option for you, but it's also likely to be the most expensive one. And so simply using a couple of different products, they might need to be given at separate times, or they might need to be given more frequently. So they're not quite as convenient, but they might be cheaper. So that allows us to have the same end result with a cheaper cost. So that's definitely something to consider. If we've got the end goal in mind, then we need to think of what's the best way we can go about getting that result. Preventative healthcare is also very important. So for something like dental health, if we institute toothbrushing, if that's possible, or we give dental treats, or we use a few different strategies to try and help keep our dog's teeth clean, then we can help prevent disease in the future and prevent the need for expensive dentals. If we keep our pets a nice healthy weight, then we really reduce the risk of them developing arthritis or developing diabetes. So we can not eliminate, but we can reduce the risk of some of our really serious diseases by concentrating on a few preventative health matters. So that's simply feeding a good diet, not overfeeding, or addressing dental care at an early stage rather than leaving it until it gets too late and we need expensive dentals with extractions. So another thing we can do is that some veterinary practices will have preventative health clubs or schemes whereby you pay a small amount every month. And that gives you your vaccinations, it gives you your parasite control, it may give you discounts on food, it might give you discount on certain procedures or drugs or consultations should they become unwell. So if your vet practice offers that, then that's definitely something to consider as well. It helps spread the cost over 12-month period rather than having a big cost, say, at vaccination time. And generally those costs will be kind of a little bit cheaper, and well, you know, quite a bit cheaper, a reasonable saving should you buy all of those things individually. So that's something to consider as well. And my last thought with preventative healthcare is not to waste your money on things that are proven not to work or have no evidence behind them. So there are a lot of fads with feeding, with different supplements and that kind of thing, with different chews, and there are lots of things out there that are touted as being the latest and greatest thing for our pet's health. But in a lot of cases, there's actually very little, if any, evidence behind them, and a lot of it is marketing. So don't waste your money on things that have got no evidence behind them, or in some cases have been proven not to make any difference or not to make much difference at all. So using what money that is available to you, using it wisely and getting the best bang for your buck. Okay, so moving on to sickness and injury and how to afford vet bills when your pet is unwell or if they have an accident and need a surgery, for example. Now, there's kind of 3 main ways that I see that we can try and afford those costs. Now, the first one, and perhaps the most obvious one, is pet insurance. So pet insurance is great. It will provide payouts for those big bills, for those kind of big ticket items. So that might be cruciate ligament surgery, for example. It might be fracture repair. It might be a week's hospitalization after your pet becomes unwell for whatever reason. Pet insurance works by paying a monthly premium, and then there'll be an excess and they'll pay up to a certain amount, or there'll be a co-payment. Insurance works in different ways depending on the company and depending on the country that you're in. There are a couple of problems with pet insurance. The first is that the cost can be quite high sometimes, and hopefully you're never going to need it, but the peace of mind that it provides can be great. What pet insurance often requires though is it still requires you as the owner to pay the bill and for you to then be refunded. So you will still often need to be able to somehow have access to the money needed to pay the bill before you then get refunded. And the other thing to think about is that in some cases pet insurance won't cover pre-existing, well in most cases pet insurance won't cover any pre-existing conditions. So if you're getting your pet insured at an older age, then either your pet insurance, the company might not be able to insure your pet, or they might have a whole wealth of exclusions. Now, another way to achieve a similar result to pet insurance is to actually start a savings account for your pet. So you get your puppy, you get your kitten, and you pay every month into their own account, their own kind of emergency fund or their wellness account or whatever you want to call it. Now, over their life, that can build up to a certain, to a reasonable amount. If, for example, you put all your insurance premiums into that account, then the chances are by the time they reach old age, there will be a reasonable amount in there. But the problem with this approach is that if your pet becomes unwell next month, or while they're still young in the first few years of life and they need an expensive surgery, the chances are that that account won't have built up to any great degree, or certainly won't be able to cover the full cost of the procedure that's needed. And that's really where pet insurance is fantastic. So like I say, it's for those big ticket items, it's really, really valuable. But yeah, paying into your pet's own account is one way to go about things that doesn't involve insurance. And then another way is that some vets might allow you to actually pay money into your pet's account so that their account goes into surplus. And that can mean that when it comes to even like vaccination, but also if they become unwell, then there's already a certain amount in your pet's account to offset the bill that will be given to treat your pet. So that's something else to consider. Now, there's no getting away from the fact that despite all of these things, vet bills can be a lot of money, and in some cases, and even in many cases, the absolute top of the range, the gold standard treatment will be unaffordable for many people. And there's a few things to say here. The first is that you shouldn't feel guilty about not being able to afford the absolute top of the range treatment for your dog. Just like human healthcare, pet healthcare has advanced at a really rapid rate over the last few decades. But with that comes an increase in cost. So the cost of veterinary equipment is astronomical in some cases. The cost of the training and the expertise taken to perform certain procedures, to carry tests or to give treatments is again very high. And of course that cost needs to be passed on. And that's why a lot of bills can be pricey. We're actually able to do so much, but it's not easy and it's not cheap. So vet bills can be expensive, but I certainly believe that owning a pet shouldn't be just for the rich, just for the well-off. Everyone should be able to benefit from having a pet in their life. They provide so much for us, and if we just look after them and give them their basic needs, so we try and keep them healthy as to the best of our abilities, then we should be able to accept that if something serious comes along, we might not be able to do the absolute best. What you really need to do is you need to be honest with your vet. You need to say, look, this is what I've got to work with. What can we do? What's the best thing that we can do? Because very often there is a plan B, C, D or E that means that we're able to try and help to try and treat our pet to the best of the ability with the resources that are available. Now, it might mean that we do have to take shortcuts, it might mean that we miss certain things out, and that's not going to be ideal, but it will still give our pet the best chance of success. If we go into something saying, well, this is what I want, but I'm not able to afford it, then that sets up an unrealistic expectation of your vet's ability to treat your pet, and also it just sets you up for a real stressful situation and guilt of not being able to afford to look after your pet. So just being honest and accepting that sometimes we're not able to do the best, but there are definitely still things that we can do to try and have that successful outcome. So where our resources are restricted, and that's just a reality, you should be asking questions about what treatment options there are, or about what testing options there are, and what recommendations are being made. So we should have it very clear in our minds that if we do this test, we're going to be able to make these decisions as a result of it. An example would be, well, your dog needs a lump removed. Now, in all cases, histology, sending it off to the lab, would be a benefit. It will allow us to say exactly what that lump is, what the prognosis and chance of recovery is, what the chance of it recurring is. But if ultimately we're not going to be able to afford the chemotherapy that might need to go on, if the mass wasn't completely removed, or we're not going to be able to do anything differently as a result of that, as a result of the lab report, then what's the benefit of running that test? It's a nice to have, but if we're not able to act on that information, then what's the point of spending money on that test? And there are a lot of things that we can do. If I've been able to narrow a dog's condition down to 2 conditions and the treatment is pretty much the same, then what's the benefit in giving a specific diagnosis? It could definitely be good to give prognosis and that kind of thing, but if it's not going to change what we're going to do, then why spend the money running the test? And that's something to definitely have a chat to your vet. And that brings me on to kind of my last point, and that is that the relationship that you have with your vet is incredibly important. So having a trusting relationship with your vet is possibly one of the most important factors when it comes to our pet's healthcare. And that's especially the case when funds are limited and we're having to make some quite difficult decisions sometimes. So being able to trust your vet, being able to work with them, and actually having a pre-existing relationship is very important as well. Okay, so I hope that gave you a few points of how to be able to afford vet bills and how to afford vet care. It's definitely something that we get on a very regular basis, and it's a reality of pet healthcare. If you've got any questions, then please leave me a comment down below. And if you've got a question for me that you'd like answered just like this, then make sure you use the hashtag Dr. Alex Answers. You can also message me on Twitter at ourpetshealth, or you can reply to one of my newsletters, and newsletter subscribers do get priority, and I'll leave a link down below to for where you can sign up to my newsletter. So until next time, I'm Dr. Alex, this is Our Pets Health, and this is the show where you ask the questions and Dr. Alex answers.